And perfect. All right. And what I'm going to do is just, okay. What I'm going to do, Sophia, I'm just going to pull up the presentation as well. Okay?
Mhm.
So thanks for everyone who's joined us so far. We're just going to wait a few minutes. We're still about 3 minutes away from the start time of the seminar or the webinar, sorry. So we'll just wait around here for a few before we get started, okay? And Sophia, I'm just going to make you the host right now, so you have a chance to, move the screen as you'd like.
Okay, perfect.
That should work.
Okay, awesome. So if I go like in here and then through here.
Yeah, you should be able to move it. So just press enter like you normally would.
And then does it like kind of go through? Can you see the next one?
I can't actually. Let's see here.
Oh, okay.
If not, I can come back to kind of come back to it. That's no problem. Let me just give me 1 sec there.
Yeah.
So that's me moving it right now.
Yeah, I can see you, hitting like the.
You okay. Yeah. Sorry, give me 1 sec there. Okay, we know what I'll do is I will do it on my end if that's okay with you.
Yeah. No,
and then you just let me know when to move to that next slide.
Yeah.
Okay? So just with the new people joining us, we're just going to be waiting 1 or 2 minutes before we get started. So feel free to get yourself a glass of water or whatever you need. And we will be with you in about 2 minutes. We're just letting a couple more people join in. All right, we're going to get started today, this evening. So first of all, thank you so much for everyone for joining us this evening. It's really an exciting time for us at Care because we're lucky enough to have Dr. Sophia Ferguson join our practice. She is amazing. It's only been a few weeks, but we've seen such, a gravitation in terms of patients towards her, in terms of the certain types of patients, and of course, just a little bit more about her. So if you don't mind, I'm just going to give you a little, pump up session. So Dr. Sophia loves treating women. She is also, really gravitates towards and resonates with pediatric care, as well as prenatal and of course postnatal care. And all of this combined is really why we wanted to bring her in, because especially in the Kawartha Lakes itself, there's lots of babies, but there's not a lot of practitioners that specialize in treating kids and young ones. So we're very lucky to have her. She has been trained in New York and graduated about a year ago. Is that right, Sophia? Yeah.
Yeah.
Perfect. And since then has done numerous and fantastic things to really raise the standard of care for women, which is really your mission at this point. Um, but without further ado, what I'd like to do is I'd like to introduce Dr. Sophia and the presentation today, which is 10 signs your baby needs an adjustment. And there's something really neat that we're going to do at the end, which we'll leave to the very later slide, and some exciting things that are happening at clinic that we're going to let you know about. The other thing is, if you do have questions throughout the webinar, feel free to raise your hand, which is at the bottom of your screen, or it could be at the top, depending on how you're looking at it, and leave the question in there. It could also be in the chat or the Q&A. At the end, we will answer those questions. And if you have questions after the presentation, you can always email us as well, and Dr. Sophia will definitely be able to answer those. But without further ado, here's Dr. Sophia Ferguson.
Perfect. Thank you so much for that introduction. So I'm really excited today. We're gonna be able to go over kind of like Dr. Manager was saying, those 10 signs that your baby needs an adjustment, also talking a little bit into prenatal and then postpartum, which I also really love. So we'll get into that. Perfect. Okay, so we're gonna get right into like what those 10 signs are. So when a baby needs an adjustment, so there's different signs that your baby may be showing you to tell you that maybe they need to come in to get checked out, whether it's the actual joints themselves, if it's muscle tension, something going on, even if it's not something that we can do, maybe we know who to refer them to and who to like send them off to, if maybe they need more care than a chiropractor. So one of the things that can be useful is if you notice the baby's head is always turned to one side. So this happens a lot in the car seat. So you might notice in the car seat, baby's head is always looking to one side in the car seat. Or you may notice when you're feeding, baby will only feed on one side and doesn't really like feeding on the other side. So what this kind of is getting into is called torticollis. So what it is you have a big muscle that runs right here called your sternocleidomastoid. So for short, it's just SCM. So it runs all the way from here to here. And so sometimes when it gets really, really tight, what it's going to do is going to shorten, and then it causes that rotation, like how it's showing in these little babies right there. So sometimes either that muscle has gotten really tight, so it needs a little bit of work, or the muscle, the joint and vertebrae that it attaches to, it can be out of place. So it's also pulling on that muscle, making the muscle come, and then it's being rotated also. So getting into that. So what we would do for that is assess the vertebrae and then do a little bit of soft tissue. And so when we do an adjustment for a baby, it's nothing like an adult. There's no cracking, there's no even rotation at all. What you want to imagine is that it's when you're checking like the ripeness of a peach, that's how like much pressure we're putting on the baby. It's the same as if you're checking to see if a peach is like ripe or not. So it's a really, really gentle adjustment, really, really soft. There's no like actual impulse. It's really just putting pressure onto that joint to restore that proper motion that it should have before. Perfect. Then number 2, so they're inconsolable. So the classic for this one's called colic. And so what the actual definition is when a healthy baby cries for a very long time for no obvious reason. So normally what happens is it's a baby cries for at least 3 hours a day, for 3 times a week for 3 weeks. So what happens is your baby's crying, and you can't figure out why. They've gone to the washroom, they are feeding just fine, they're extremely healthy, but they're still crying at all hours. So I'll get a lot of patients through this way because the parents, they're out of options. They're exhausted, they don't know what to do next, and they heard, what the heck, maybe a chiropractor will help. So I'll get a lot of patients this way, is because the parents are out of options and they don't know what to do. And then a lot of times the baby, after seeing me, then is able to sleep through the night. So different things can cause this. It can be either, a lot of times the most common is actually gas. So baby has just like so much gas inside them that they can't get comfortable. It hurts their stomach so much, so they're in a lot of pain that way, but they can't like tell their parent that that's what's going on. They can be also like just very stiff, and the muscles can be really tight. Sometimes you might see this when a baby tends to do a lot of arching in bed. You might notice that they're like really, really arching and it doesn't look like they can get comfortable. So going through it those ways. So colic, that like inconsolable, that's like one of the signs that you should bring your baby in. The next one, reflex. You might notice that your baby has a lot of spit up, a lot of reflex. So same thing, what can happen is in the upper thoracic spine, so in your upper back, you have a lot of nerves that come out of there, and they're the ones that innervate all of the organs that are responsible kind of for the reflux. So getting into our stomach and our esophagus. So when it's out of alignment, it could be constricting those nerves and not sending a proper pathway to those organs. So we will look at the upper thoracic, that upper back area, to see if there's tension, see if there needs to be any of those adjustments. And it typically tends to help with that reflex, because then everything is going back into reset and the baby no longer has so much reflex, because the organs, they're able to do the job that they're supposed to be doing. So number 4 and 5, I put them together because they're very much related, and same with that colic kind of for the gas. So we have, if they're very gassy, or if you feel like they're constipated or have irregular bowel movements. So you might notice that baby is really like, they have to really like force, like when they're having a bowel movement, or you might notice like, oh, my baby has a like bowel movement once every 5 days. So typically what we would like is for have a baby to have a bowel movement every day. Not every baby's going to have a bowel movement every day. Sometimes that's not their normal, but typically once a day is what we would like to see. But if they're going on to 5-6 days without having a bowel movement, no, that's going to cause a lot of pressure inside the baby. So it's going to make them very upset. So what happens is at your sacrum and your pelvis, you have nerves that come out of your sacrum. So right where like their tailbone is, just above that, you have a bunch of nerves, and they innervate everything to do with bowel movements, going to the washroom. So all of those organs, they innervate your bladder. So when your pelvis is out of place, sometimes again, those nerves are getting restricted and aren't sending those signals to those areas where they should be. So a lot of times when you do an adjustment for the baby, a lot of times they'll poop like immediately, like on the table, because that like joint was just like not in the right spot. So the nerves were getting compressed. And a lot of times right away, the baby will have a bowel movement. And that's all. It's because it wasn't able to get those nerves to those organs. So that's like a really popular one also. Difficulty breastfeeding. So we talked about this one a little bit when we were talking about that torticollis. So same thing. So if your head is going like this because that SCM muscle, you're having a hard time turning. And when you're breastfeeding, baby has to be able to look both ways in order to get on each breast. So if they're only on one breast, you might notice that is because maybe they're not able to turn their head to get onto the other breast, like on the other side. So a couple other things, baby also has to be able to elevate their chin in order to breastfeed. So if they're not able to elevate, there might be something stuck at the back of their occiput, the back of the skull. So if they're not able to properly extend, same thing, they won't be able to properly breastfeed. A lot of times it can get really tight in their jaw muscles. And so if they're not able to fully open their mouth, again, they're not able to get that good latch. So there'll be sometimes if you listen, it sounds like it's like a lot of sucking and it's a lot of air. So if you get a lot of air coming in, 1, that means baby's not getting that much milk. And then 2, they're going to get very gassy because they're getting so much air. So you really don't want to hear baby being too noisy when they're breastfeeding. They should have a really good latch, and there should be no holes like around. It should be like a really nice big latch. So if they're really tight around their jaw, they won't be able to get that big latch. And then the last one, it's getting more popular now. So it's called a tongue tie. So I'm going to talk about this in another one, but a tongue tie is another reason why they could have a little bit of difficulty with that.
And Dr. Sophia, just to clarify, I know we talked about breastfeeding quite a bit. Does that same principle apply to bottle feeding?
Yeah. Oh, sorry. 100% for bottle feeding too. Absolutely. Yeah. So same thing. If they're not able to get it, or if they have a bad latch on the bottle, same thing. They're going to be like very gassy. Even if some moms are using like nipple shields, like all those kind of like feeding techniques, 100%. You're right. It's the same.
Perfect.
So this one, I put these two together also. So the way the baby was delivered can have a lot of effect also. It can actually have effect like years later. So what happens is for the first one, sunny side up births. So normally what happens is when a baby is delivered, their head is actually delivered like upwards and the face is delivered down, just because then it's a better motion for getting out and it's not banging on mom's sacrum. So when the baby's delivered face up, it forces a lot of extension in the neck when the baby's faced up. So it can put a lot of tension into the neck. And then mom will be in a lot of pain too. It's kind of like that back labor. That's when the mom will be feeling back labor because the baby's, the back of the skull is just banging on mom's sacrum. And then the second one is if they have any assistance. So whether it's a vacuum or forceps, just because it's that extra pressure and that extra tension on the neck, because they do have to pull it, it can cause a lot of issues in the cervical spine. And so cause a little bit of issues later on and discomfort for baby. So if your baby came out sunny side up, or if they had a vacuum or forceps, it could be an idea to come get them checked out just to make sure that everything is still in a good alignment. Good. And then difficulty sleeping. So this kind of goes with that colic also, because when they have colic, they tend to not be sleeping. So this is another common one. If you notice baby's not sleeping, or they're only getting a couple hours in, or they're not able to have sleep for like a longer, like consecutive long time, they just have like a 30 minutes up, 30 minutes up, like they're not able to actually have like a couple hours in. So getting adjusted can really help with sleeping also, to maintain a longer and more like actual deeper sleep.
I guess like who doesn't want that? Especially
Yeah, exactly.
especially the
Good
moms,
for
right?
everybody. Okay, so this is that last one I'm talking about. So post tongue tie release. So a tongue tie, first of all, is you have a frenulum. It's called the frenulum. It's what attaches like your tongue to your actual mouth. So everyone has a little one, but sometimes babies can develop a very thick one. So babies need to have proper tongue movement in order to latch and breastfeed, and even talk later on. So our tongue needs to be able to move properly. So a lot of times when moms are having difficulty breastfeeding, this is one of the first things that it's checked, because we want to see, can baby get the tongue under to actually latch to actually breastfeed. So we're able to, first of all, sometimes they're missed. So we're able to look, see if there is a tongue tie. And normally if there's a tongue tie, there means that there's tension throughout the body also. It's just like how it goes. If you've developed this, you've most likely have a little bit of thickening of tissue throughout your body also. So they're going to have more tension throughout their body. And then number two, if you have gotten a tongue tie revision, so what happens is normally you'll go to the dentist, and the dentist with a laser will just cut it. It's a very, very quick, easy procedure. So they'll cut it, and then baby has a better latch and better movement of the tongue. But it's like anything. So if you bring in your baby post tongue tie release, we'll be able to go in intraorally and do some releasing. So first of all, we want to do releasing all around the jaw, because they're most likely it's gonna be very tight because they weren't able to use their tongue. So they had to use a lot of jaw muscles instead of their tongue. And then second of all, we want to really get under there to help so that it doesn't come back, because of the scar tissue, it can reform. So we want to make sure it's all nice and loose under there, and then it's not going to return, and the baby is able to move the tongue freely. All right, so I love this one. I love them all, but I really love pregnant women. I do love postpartum too. I love them all. So I really notice a big difference for women who come in while they're pregnant. The odds of most women who are pregnant, there's an 80% chance that you're gonna have back pain. So 80% of women have low back pain while pregnant. So while this is very common, and it's most likely happening because of all the changes. So you're gaining a lot of weight, your center of gravity is changing, everything is shifting to the front, because as your breasts are getting bigger, belly's getting bigger, everything's getting brought to the front, it's putting a lot of pressure into the back. So first of all, learning proper posture and how to be tilting your hips and having a proper posture, what to strengthen, what to lengthen, all of those really help your pregnancy throughout. So if you're really paying attention to your posture, you can really help with that. And then the adjustments really help, one, release tension, and then two, help to maintain for proper alignment. So women come in primarily for back pain, sciatica kind of pain, so that pain into your bum that can go down into your legs, hip pain, a lot of hip pain, pubic symphysis pain, so pain at the front of your pelvis, and then headaches and nausea. So this helps a lot with these. And then even if you aren't, let's say, having any pain, it's really great to come in also, because we want to make sure you have proper alignment of your hips. So something that I have, and some of the other doctors have, it's called the Webster technique. So it's a technique that really makes sure that our pelvis and body is in proper alignment for baby and for birth. So I put a picture of this pelvis. So this pelvis, it's as if imagining you're looking like down at it. So I'm showing you the inlet. So we want to make sure this inlet is as perfectly circle and as wide as possible for birth. So what happens is our pelvis is like this. So how it is in the video. So what can happen is if we shift, it can shift front and back, and it also shifts like this in order to widen for birth. So what happens is if we start to shift like this, we're narrowing our pelvic inlet. So when baby's going to be born, there's not as much room anymore now for baby to be born. So there could be not complications, but it just may not be as smooth as a delivery as it possibly could be. So with chiropractic care, even if you're not in pain, it's great to come in just to maintain that, really that symmetry for your pelvis. So then you have an even better labor and delivery. And with this technique, it's shown to reduce labor time also, because you're not struggling through where a shoulder or arm might get caught in the pelvis. It's able just to come out nicely. So going into that, and then also if you do exercises and everything during your pregnancy, it leads to a better postpartum because you already have that strength from pregnancy. So it carries into your postpartum. So you have a better postpartum and able to heal just a little bit, not like quicker, but just a little bit better than if you had been doing nothing before. Awesome. And then postpartum, which I also love. So postpartum is extremely neglected. It's actually what got me into kind of this raising the standard of women's care, because women have always been seen like, oh, I pee when I jump on the trampoline. Oh, I, pee when I laugh. And then we've been made to believe it's very normal. And while it's very common, it's not normal. It means that there's a dysfunction in your pelvic floor, and it's unable to maintain the pressure. So every time you sneeze, that pressure, we should be able to maintain it, but you're not able to maintain it. So number one, it's great because we can work with pelvic floor physios, but then two, we can be doing our own exercises and kind of assessing what's going on. So that's what really got me into it. Is I didn't think that women deserved to feel like that and to be in pain after postpartum and to feel very alone in their care. After 6 weeks, everything is about baby and mom get their 6-week care. But after that, that's it. There's no more. And for cesarean sections, C-sections, it's one of the only major surgeries where there's no rehab prescribed. If you think of any surgery we have, if you get knee surgery, hip surgery, shoulder surgery, any surgery, there's always some sort of rehab prescribed. You see a physio, you do something for the rehab. You get more than one checkup. But C-sections, you're cutting all of your major abdominal muscles, which you need for everyday movement. And there's no physio, there's no rehab. There's one checkup at 6 weeks postpartum. And then that's it. You're allowed to go off and do whatever you want. So having somebody who understands postpartum can really help you through that postpartum time, that 4th trimester. So a lot of times I get women coming with a lot of back pain. And the problem is that their core is still so weak, not just from C-sections, but also just from pregnancy, because during pregnancy, so like on this picture that I have there, you've got a group of muscles and your muscles normally come together. But for pregnancy, of course, they naturally have to separate just to make room for baby. This is absolutely normal, happens in every single woman. But the problem is that when it's coming back together. So in some women, it doesn't fully come back together or as strong as it should be. Sometimes there's still a little bit of a gap. So having someone who can assess to see how far is the gap, how much is it impacting you, and then doing a rehab program in order to get it to close better, then you'll be able to use your abs instead of using your back to do that work. And then just having someone care for you also, instead of just only baby, because you're going to have a lot of upper back pain from breastfeeding or just with the bottle, constantly like watching baby, having your neck down. Also carrying baby on one hip all the time while doing other tasks, it really throws things off. So all of those can really cause like a lot of pain, and moms kind of forget about themselves during the process of having like their little ones. So they can benefit a lot from care. So that's in a nutshell, a little bit about pediatric postpartum and prenatal. So what we wanted to offer you is, if you want, so this is a QR code. So with your camera on your phone, you can open your camera app and it will automatically pick up this code, and it's going to take you to our website, or you can just go to corthacare.com, and we're offering a complimentary baby visit. So you can bring your baby in, we'll do an examination and see what's going on in treatment. And then it'll be a 30-minute treatment, and we're offering this until December 10th. So it's really exciting. So you can bring your baby in, and you can, of course, ask any questions about it. If you're nervous about it at all, at any time you can ask, and we'll do a complimentary call without any charge for that.
Thank you so much. Thank you so much, Dr. Sophia. That was awesome.
Yeah.
So just speaking from personal experience, I have two young girls, and I had care. Obviously, I'm a little biased because I'm a chiropractor myself. However, that being said, I can really speak to what you're saying. And I had care throughout my first pregnancy and definitely throughout my second. Knock on wood, I had a really good labor throughout both, very short. And obviously there was going to be pain there. Can't really get away from that part of it, but it was as smooth as it could be. And I actually started taking my first daughter, who's now 4, to the chiropractor 3 weeks after. Not to
No.
myself, of course, because you're the mom. So it's different to be a doctor and a mom at the
Yeah.
same time. And so I ended up taking her as well. And she just loves seeing the chiropractor. She's the biggest advocate. And whenever there's something that's of concern or just for a wellness, she is there once a month. My other little one has started to go as well. And, she had torticollis as well and was not latching properly. I was breastfeeding at that time. And that was something that was really nice to see resolved. And what I love about kids and babies is they don't lie. So if they're going to get better, you're going to see it, and you're going to see it objectively. They don't lie.
Absolutely.
They're very honest. If they're verbal, like if they're young kids, they'll tell you, like my daughter does, she loves seeing the chiropractor. That is the highlight for her. And if it's young ones that don't speak yet, things like torticollis or tongue tie, you will see those results. We actually had a baby patient, 4-month-old, and the mom called me as soon as she got home and said, "Hey, what happened to my baby?" And I said, "Oh my God, like, what did I do? I was so scared." She said she pooped like crazy, and then she had the
Oh,
best sleep after that. So
good.
there is just something so nice to be said about these little patients, and obviously throughout their pregnancy and postnatal process as well. So thank you for sharing all that information.
Yeah, of
I
course.
really encourage those moms who have babies or kids or even are going through pregnancy or postnatal to really sort of take part in this. And if you're uncomfortable with the adjustment idea or you're not sure how that's going to work, again, we don't necessarily have to lay any hands on your baby. It can just be a conversation, right?
Right, absolutely.
Come in, get comfortable. And if it's not for you, that's okay as well. But it's really nice to be able to at least have that interaction and the information. And we love babies in the office. So if you want to bring your babies and you want some babysitting help and while your adjustment's happening, we can take care of the baby as well. So that's okay. That's free babysitting.
Yeah.
So again, thank you so much. It was very informative for myself as well as everybody else here, I'm sure. Any questions that anybody has, you can pop it into Q&A or the chat box. So we'll start there. Any questions? And if you don't have any, that's okay as well. Any specific concerns, perhaps, that maybe you want to share anonymously if you'd like? You can do that. And if you don't, and you can't think of anything at the moment, that's okay. You can always reach us and shoot us an email, book a complimentary call, or again, a visit, and we'll be more than happy to help you out there. So thank you so much for taking the time out, everyone, as well as you, Dr. Sophia,
Yeah,
this
thanks
evening
for having
educating
me.
us. And I hope that everybody has a great evening, and Christmas is 24 days away. So yeah, a great holiday season. Thank you.
Perfect. Thank you.